Hello, viewers around the globe. We want to welcome viewers worldwide and more than 71 members of the Global Emergency Disaster Response Team, and also youth around the globe are joining Ambassador Arikana. She was a medical doctor and a former African Union ambassador to the United States. And today she will give a full presentation about intention and a motive and how she going to establish a COVID-19 emergency disaster response center in Africa. Welcome, Ambassador Arikana.
Thank you for having me.
Yes, Ambassador, viewers all over the world, and with this your great initiative, they want to hear from you with the good job you want to do for the African continent. You can go ahead, Dr. Arikano.
Thank you all very much for taking the time to come to the call at this time. The organizers of the disaster response team, I commend you for the amazing work that you're doing in doing your part in addressing the scourge of COVID-19. I also like to thank my brother, Ambassador Fode, for bringing all of us together. This event could not be happening if it were not for his efforts. And so my great appreciation to the International Human Rights Commission. Again, to underscore what you just highlighted, the world is in a state of emergency. The world has been invaded by a scourge that is of immeasurable proportions, and it is incumbent upon us to do our part to address this scourge. I have kept up with developments on the continent. President Cyril Ramaphosa has done a great job at keeping us abreast in terms of what is happening on the continent. The director of CDC has done a great job at keeping us abreast in terms of the statistics on the ground. And it is very clear that the numbers are going up. We're now over 400 deaths in Africa. We have over 10,000 infected, and the numbers keep rising. The biggest fear is that the epicenter is soon going to move to the continent of Africa. I must say, I would like to also commend all the heads of states for the great job they're doing in protecting the borders and making sure that they put in place containment as well as preventive measures. As far as protecting the borders, they've done a great job. The biggest challenge, however, remains the issue of protective equipment. That is where we are going to fail. A lot of funds are being mobilized, but unfortunately at this point, they're being mobilized per nation. Each country is doing the best they can. On a given day, the average African country does not have enough medical supplies to handle the day-to-day ailments that the citizens of that country are going to be facing. So you can only imagine what's going to happen in a pandemic situation. The measures that have been taken and are useful and are working in the developed world are not always going to be as easy to apply on the continent when you realize the challenges that the citizens are facing on a day-to-day basis. Citizens, issues pertaining to the living conditions, which are crowded, issues pertaining to poor access to water, issues pertaining to lack of access to power and hence refrigeration, the funds to stockpile food items. The challenges are humongous. Countries that can afford it have taken measures such as South Africa, where they are pulling, they're sending tons of water tanks to different parts of the country. Some cell phone companies have dispatched and donated cell phones to healthcare workers who are now responsible for educating the communities throughout the country. The countries that can afford it, like South Africa, President Ramaphosa is doing a great job. Some Northern African countries, they're doing a great job. But the extent of the pandemic is such that regardless of what is being done by each nation today, there's going to be need for a lot more. And that's where we are coming in as the African diaspora to say, whatever efforts our leaders are making on the continent through the African Union, through in collaboration with the African CDC, in collaboration with Afro Champions, they have established a fund. We are saying as a united African diaspora, we also have a responsibility, and we must join our leaders and our brothers and sisters, the private sector on the continent, in doing our part to address the issue of corona. You must also realize, not only do we need the PPEs, let's be real about it. The healthcare workers are the ones that are going to face the biggest challenges. Not only do we not have enough healthcare workers in Africa, they are also not going to be well equipped for the challenges ahead. So let's make no mistake about it. Just like we're seeing in Italy, the healthcare workers are the first ones that are going to die. And when we lose our healthcare workers, Africa is finished. So I cannot stress enough the importance of us African diaspora understanding why this time we can no longer continue to be divided along racial lines, along ethnic lines, and along nationalistic lines, but that we need to face this monster in the face as a united front. In addition to pulling our resources together, for those of us in healthcare, we also need to start thinking seriously about carving out some time, because there may come a time we may all be called upon to have to go home and join our brothers and sisters in fighting this scourge. There are just not enough healthcare workers on the continent. If I may put things in perspective for you, Africa today needs roughly about 1.2 million doctors. We're nowhere near that number. And like I often say, there are more Ghanaian doctors in New York City than in Ghana. There are more Nigerian doctors in Los Angeles than in Nigeria. So on a given day, Africa is already way behind in terms of the healthcare capacity that we need. Not only are we behind in the healthcare capacity, we're also behind with the resources needed, the tools that the healthcare workers need. So the challenge is a seriously uphill battle that we must all be very realistic about. And as African diaspora, we understand what the brain drain has done to the continent. The continent has been drained of her children since slavery, all the way to more recent immigrants who left the continent in search of greener pastures, some running away from wars and famine. But the end result is Africa is in need of its capacity, which is in the diaspora. If there was ever any time for us to come together and realize that the time to go home, whether we go home physically or we go home through financial support, one way or the other, we must go home and join our heads of states and government and our brothers and sisters in the private sector to support whatever efforts that must be done in order to prepare ourselves what seems to be an inevitable pandemic that's getting ready to hit our continent. African Diaspora Development Institute is an entity that was born out of the realization that our heads of states, to the extent that they would love to join hands with us, it's very difficult to engage the African diaspora. We're all over the world and extremely divided. I'm not saying anything that all of you don't already know. What I'm asking is that each and every one of you, on an individual basis, take a moment to introspect and ask yourself, what can I do as an African diaspora to play my part in addressing this scourge? The brain drain that has occurred in Africa over the years has got to be reversed. And that starts with you and I making a commitment. And this time, forgetting any grievances we might have, any disappointments we may have faced as far as what is going on in our continent. This is not the time to be pointing fingers at anyone. It is a time for us to unite. We have a common enemy. Like the saying often says, there's nothing that unites more than a common enemy. Let's understand that we are facing a common enemy. which is COVID-19, an enemy that we all must address. So ADDI, we're hoping that we can reach out to as many African diaspora and friends of Africa, and any who wish Africa well, to pool our funds together. We have established, we're in the process of fundraising in order to buy the much needed supplies, which are the N95 masks, of course, the surgical masks, the surgical gowns, the bodysuits, the testing kits, the medical supplies that are needed to treat these patients. We're going to be needing also isolation units, everything that is needed to see to it that when patients become sick from coronavirus, they receive the appropriate treatment that they need. Everything that our frontline workers need is going to be available for them to do what they do in a safe environment. So ADDI, African Diaspora Development Institute, which you can visit at ouraddi.org. Please visit ADDI, go to the COVID-19 task force and donate whatever you can. But we also ask you to register so we know who you are, where you are, and what you do. Whatever it is that you can offer, we would like to keep you updated as far as we hear the information and the developments that are going on the continent. We would like to keep you updated as well as what is going on. But the time is now for all of us to take the time and do what we can to prevent what is seemingly going to be a catastrophic event in our continent. It's already, COVID-19 is already wreaking havoc in the Western world. If it's wreaking havoc in the Western world, you can only imagine what is going to happen when it hits Africa, when it peaks in our continent. So once again, I am here to say, African Diaspora Development Institute, it is the institute where we are all going to come together as a united African diaspora to join and support all the efforts that are being done on the continent through the African Union, through the African CDC, through the Afro-Champions, and the individual African governments. So I look forward to working with all of you. I'm looking for your support, and I hope you can share the news that we should all join ADDI as African diaspora. Once again, ouraddi.org. Please join. We want to know who you are. Stand up and be counted because you matter. I thank you.
Thank you very much, Dr. Arikana, for the wonderful presentation of this initiative that you have for Africa to establish COVID-19 Emergency Disaster Response Center in Africa. And also, I think we could come to you back, Doctor. I think we might look out for one or two questions from all the people who are part of us today so that you could respond to them. Mary, are you there? Hello? Yeah, Mary?
Yeah, I'm here.
Mary Apollo, do you have a question, a quick one?
I just
commentary, just, yeah.
Brief coverage of what Ambassador Arikana have said.
Yeah.
She talked in general about the challenges that we have in the continent, and from the poor access to water, to medical equipment. And she asked all of us African in the diaspora to come together and to support the continent. And that work should be done by the ADDI Diaspora Development Institute Center. So each individual who have a donation or wanna join us in doing the work should go there and come with their donations. So this is a brief description of what she have said. And then right now, I would like to call on Dr. Khalfani to give his intervention about the doctoral speech. You're welcome.
Okay, thank you very much, Mary. We just got to make it quick and short, maybe two minutes. Yeah, doctor, we are waiting upon doctor.
Dr. Khalfani.
Um, okay, I think we lost him. I think we to go to the next. Mary, can we get back Mary? Mary Apollo.
So we waiting for Dr. Khalfani to get in. He's already here right now.
Yes, yes. I'm sorry. I'm back. Hello.
Yeah.
Good afternoon. First of all, I want to thank all the ambassadors on the call. I want to thank Ambassador Fode for organizing and pulling this event together. And I want us to think about the fact that as we're talking about the diaspora and talking about ways in which we can be impactful and anticipate, I'm a sociologist by training, and I think we have to look at the social factors that are involved, as well as the factors that are involved as far as medical factors, because of the social impact on the community. And Ambassador mentioned the fact that we have to look at the marginalized communities. If we go from South Africa all the way up to the north, or the west or the east, and we look at those communities that are that potentially can be heavily impacted because of their close proximity, like in the townships or other very, very tightly, densely populated communities, we have to think about the potential impact in those areas if there is a major outbreak. And one of the things that I think we need to be cognizant of is that we can look at the United States and look at the impact of who's been the largest impacted group. Initially, there was a lot of discussion about Africans and people of African descent not being largely impacted by COVID-19. But if we look at some of the most recent data, that it is the African-American population in the US that has been largely impacted. And that those large numbers, I think we need to think about, because what it speaks to is not necessarily that African people are more susceptible to this disease in and of itself, but that we have already underlying conditions in greater numbers. So there's already health disparities that that COVID-19 will be a multiplying effect for. And so when we think about it in that way, then that gives us kind of a precursor idea to think about other places where there are marginalized communities, communities that don't have access to adequate health care, have higher cases of diabetes and hypertension, high blood pressure, and other kind of underlying diseases. And we can think about the impact that that's going to mean. We think about the fact that people who don't have money, when we have these major shutdowns like we're having here in the United States. I live in New Jersey, and folks who are middle income or upper middle class, they have access. They can get things that they need. They can get food and other things. But somebody who is working a day-to-day job, or somebody who is already unemployed, is in a very precarious position. And I think that we need to think about what our ambassador is saying to us, to think about how do we begin to plan for the impact on those communities throughout Africa and throughout the African diaspora in the United States and Brazil. I've been gotten some reports from some colleagues in Brazil and other places where there's similar kinds of concerns about African marginalized populations. And when we think about ourselves collectively in that way, what this, I think, becomes a mandate for is for us to reconsider how we think about Pan-Africanism, and that we need to think about that this is a call to us to be Pan-Africanist in our greatest sense. That is, that we need to think about us around the globe and how we can collectively come together to utilize our resources, how we can collectively come together. What is the innovation that African people, that we can come up with if we don't have the resources for certain things that are available? What are some of the traditional alternatives that we have been able to use, traditional medicines and other things that really what the contemporary medicines and things are built on? how do we have a containment place in some place where somebody has a one-bedroom house? Do people end up creating their own confinement spaces in such ways that we didn't think about in the past? I think we have to really push ourselves to think outside the box about how to address this in ways that this is a new day, that this is a new thing that's going to impact us in a holistic fashion, financially, psychologically. What is the psychological impact for people in our community for how this is going to, they feel endangered, they feel threatened, they feel fear because there's so much going on. The police coming into the communities, the military coming into the communities. All of these things are things we have to put on the table and develop a holistic solution to how we approach this. And I want to implore us to think collectively, as Ambassador was saying, not just about my country, not just about my family, not just about my neighborhood, but our collective impact and how when we do things collectively, that we change the world. And we can see this as an opportunity for us to get back to some African basics. In South Africa, they may say Ubuntu, to get back to those basic ideas that are going to be paramount for us to really address this head on. Because any other way, I believe, is going to be, as already has been suggested, traumatic for us. And we need to be careful to hedge off any greater trauma than that which has already began to impact us around the world as African people, and learn how to lean on each other, learn how to listen to one another, so that we can not want to just be heard, but also listen for the subtleties of what someone else has to say, so that we can pick up on the lessons, the experiences that we have. And it doesn't matter if you are Kikuyu or Fulani. It doesn't matter if you're Jamaican or if you're Ghanaian or African American. All we have in all those instances, we need to be able and willing to come together and think about these things and come up with collective solutions. And I'll stop with that. But that's the real thing I wanted us to think about is that. And I'll also say that as someone in the United States, I'm running for Congress. This is not a platform for that discussion, but I want to say that we need to have people who we can have in those positions to push for the type of African diaspora concerns that we need to be addressing, so that we have people who are have the voice and have the ear of the African countries, but also can have a voice in a country like the United States that can advocate for the types of things that we need as African people. We need to be advocating in all of those places for the things that are going to help assure our safety, our security, and our strivings forward as a people. And I think that's the thing that I think that builds on what this agenda here is about.
Thank you. I would like to thank Dr. Kalafani. He mentioned an important point about all of us Africans. We have to come together and unite regarding our diversity and work to help our continent and to serve our humanity as Africans. Next, I would like to call on Dr. Arami from the Dongot Foundation. He's going to give us a short speech about the initiative. So, welcome, Dr. Arami.
Good morning.
Yeah, good morning. Welcome, we are here.
Good morning, good morning. Thank you for having me in this very important meeting. And thank the Dr. Fode also for arranging all this very important meeting. He just called me a couple of days ago to inform me about this African diaspora from the Institute. And first time I tell them is very, 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 very good idea, because I believe what happened to the United States is a lesson for everybody, because they was not wary when this virus hit United States. And we see everybody today what's going on. We have almost over 2,000 dead per day for the last 3-4 days. And countries like the United States having this impact. What's going to happen to Africa when this virus hit Africa? Because right now it's nothing happening, because we see every day the scale is going up, every day is going up, every day is going up, but they're not even ready yet. Example, just to take Senegal for example, because yesterday was they was having a lot of meetings about the same problem, because they don't even have hospital who's ready to treat these sick people. They have only maybe one hospital will have only 100 beds ready now, when they have about maybe 200 sick people, and every day they have 10 new people. I think these organizations have to be very ahead, like right now today, to implement something like a distribution center for somewhere in West Africa, to be able to send equipment as very fast when one country is hit. Example, if you have a distribution center, example, in Guinea, and Senegal is need equipment right now, I think it's going to be possible and to move the equipment from Guinea and bring it to Senegal. And if Mali need it, you bring it from Guinea to Mali when they need it. Not just to use what we have, the source we have for every country. No, we just probably gonna have one distribution center for all this equipment, and we have to have it as soon as possible, because I believe from when this virus finish America, is gonna hit Africa, because every day I'm watching, every day the numbers is going up, is going up, is going up. I already talked to some people, even I already sent the presentation to Dangote, and I already feed Mr. Fode for all the communication and having with the group. And I believe also the group is concerned about the same problem, because even in Nigeria, every time I call, they've been having a meeting every day, because everybody is scared now in Africa, because it's going to be a lot of impact, social impact. It's going to be because in Africa is different, because people, they day-to-day workers. They every morning people go out to try to get food, try to get stuff. It's not like they have United States. People go to work every day, have a salary. No, over there people just live day to day. And now, if you for 30 days, example in Senegal, nobody go out for 30 days. They just allow them to go out in the morning. By 8 o'clock at night, nobody go, and you cannot travel city to city. So it's very difficult right now for them. But so what the government is doing right now is giving food to the population by the military. Okay, and just the logistic to do this. Yesterday, when I have the numbers, it was $12 million just for the food to distribute all over Senegal, because the logistic, they have to get the cars, they have to get the gas, they have to get the people. When they sent me the numbers yesterday, it was $12 million. And even myself today, I'm shipping just today about $2 million of equipment from China by airplane. That means only one country, they don't have nothing. And Senegal right now, no mask, no mask, they don't have no mask, they don't have no gloves, they don't have nothing right now. And the people who have it, they jack up the price by 3 times more than the regular price. So I think this is a very good idea. And me, I do it myself 100% to this. And whatever I can do, I will be inside. I'm ready. And I think this is what Africa needs. And I'm thanking everybody for the idea, everybody for the time. And I think if we don't do this right now, Africa will have a very big problem when the virus hits. Thank you for the ideas. And I thank everybody, and especially Dr. Fode, Ambassador Fode. Thank you.
Thank you, Dr. Arami. He gave us a a very brief intervention. He mentioned that it's time for us all to come together and to serve the situation back in Africa. So right now I'm going to introduce Reverend Cleveland Polite. He's going to give us a special statement about the current situation. You are welcome to join us, Reverend.
Yes, Mary, I think, yes, Reverend, are you there? Mary, we need to get Reverend. I don't think Reverend is getting us clearly from here. Maybe Reverend phone is on mute.
So Reverend, yeah, just trying to get Reverend on the line.
He said to replace him. He is having trouble. Call Reverend Hargrove. There's another Reverend on the line with them. He's ready to speak, but his own machine is not working.
Mr. Fode, can you position your camera well? We just seen the top of your head.
Okay, Abdullah,
Yes, Mary?
we have to replace him with the another Reverend on the line. Can you?
Okay, yes, is the Reverend there? Can the Reverend come on? Who's Reverend gonna come on now?
Okay. Thank you.
Excuse me, Dr. Fode, nobody can see you.
Yeah.
Okay.
Yeah, Mary, what is the name of the Reverend that we're gonna replace with? Mary, are you there? Viewers, for you that are just joining us, this is just a presentation of a brave ideology from Dr. Arikana, and she was the former Africa Union ambassador to the United States, and she's just joining with support from the Global Emergency Disaster Response Team Youth and youth around the globe in support for the establishment of a COVID-19 Emergency Disaster Response Center in Africa. And now, Mary, are we still there? Who is the next speaker that we're going to get over to, Mary?
Okay, we are going to replace with Reverend Howgrove, who is going to inform us and give us a speech and highlight about the Emergency Center of COVID-19 in Africa. You're welcome.
So far, if we are getting difficulty in getting the next speaker, Mary, can we call on Dr. Arikana to comment so far on some of the comments that you guys have already gave?
I think I'm just going to give Jonathan Efe a chance. So he is one of the youths. He can get his intervention, and then from there we can go to Ambassador Arikana to give her comment and maybe conclude for us. Thank you.
Okay.
Welcome,
thank you.
Johnson. John Bosco. Welcome.
Thank you, Mary, for this wonderful program. And thanks to Ambassador Fode and Dr. Rikana, thank you for bringing out time for your busy program. Africa is always a place we use to give example, not because some other places do not have issues, but there are more issues in Africa than you will see in other places. Today, the WHO has told us one of the things we could do to safeguard ourselves is social distancing. But there are only few families in Africa who have the opportunity of having a larger space in their house for social distancing. This is a real cause for fear because the numbers are going high, and this virus is not like a sunburn or an injury that you will look at someone and you know the person is already infected. So it's a serious challenge for Africans that if one person goes around carelessly and then brings this thing home, is going to infect a family, from a family it gets to a community, and from a community it might get so hard that it becomes difficult to
Don't freeze.
the fear might go higher and people will run into more problems. And this is a serious cause for fear and a serious concern that we need to work on. And that is why this initiative by Ambassador, the AU Ambassador, Dr. Rikana, this initiative is one thing that will save Africa. It will do Africa a lot of good because they say prevention is better than cure, but now the problem is here. And the best we can do is by, giving it the best we can, involving the youth. And I believe the best method of, fighting back at this coronavirus is by giving the youth, especially, some self-orientation. Over here in Nigeria, for example, it baffles me to see a group of people discuss, and when you listen to them, their discussion is based on if coronavirus is real or it is not real. It's disappointing because it is at this time that people are looking for solutions, and some people are still, below the ladder, thinking if it's real or if it's not real. So those people are, more at risk, and these are people who are very ignorant, and they can spread it so fast than wildfire. What can we do to get the youth actively involved in this orientation? We are already working on self-distancing, but we still need people who will volunteer, who will take the risk to go out to villages, rural areas, talk to farmers who do not have access to the internet, talk to those who do not have power to see the news on their television. We need to organize ourselves the more, and thank God for this global emergency disaster responders team. We are really doing a great job, although from of our home through the internet, but more needs to be done. This will not just cost us time and data, it will also cost us going to these remote areas using the local transportation. Thank you, Dr. Rekana, for what you are doing. I would also want you to advise us on how we can get these youth to do this orientation. Thank you.
Thank you, John Bosco from Nigeria. Next, I'm going to have Alicia on the line. She's from the Caribbean. She will just give us 1 minute of her comment about the initiative and what she's saying we should be done. Welcome.
Hello, everyone. Good morning to all, and thank you for having me today again once more. I think it's a great initiative altogether, and we all should play a role in togetherness and to achieve our main initiative in everything. And I must say that based on what Mr. John Bosco has just mentioned, we were having a conversation earlier and about social distancing and how it's been very difficult to maintain social distancing in small apartments with a lot of people. And one thing that I pointed out, and I think in my opinion is that uh, people should be positive in a household of such or in an apartment. They should be positive that everybody carries out the necessary measures that are advised to be taken. For example, you should always wash your hands. You should always, um, follow the necessary precautions then, like, if anybody is to go out to get essentials, and you coming back, you need to take all your clothes, leave it outside, do the necessary precautions so that everybody will be safe. So that's probably it for me today. Also, we need to, always remember to respect our farmers, and our farmers are very important to us. And yeah, thank you, everyone.
Thank you, Alicia. We are going to hear from the next youth in our initiative. We have Francis here who is going to give us his comment. You're welcome, Francis.
Hello everyone. My name is Francis Koma, and I'm from Sierra Leone. And I totally support the initiative of Dr.
Francis, can you please speak louder a little bit?
Oh, can you hear me now?
Yeah.
Okay. I said my name is Francis Koma, and I'm from Sierra Leone, and I'm a youth ambassador as well. So I totally support the initiative of Dr. Americana, and also the the work that's supposed to be done in the ground in African countries. Let me say, for example, we need to create more awareness, and because like sending messages to the people, and exactly what my brother from Nigeria was saying, to the people in the villages, and for those who can get access to this information online and on onto the internet. And also we need to get more people on the ground to go on outreach so they can pass on the message. People are hearing about the coronavirus and then other diseases, but like not everyone is taking it more seriously or know what the precaution is, and what to do and what not to do based on what the government is saying. But yet still we need to do our own best in our own individual, from the diaspora and from everywhere from across the globe. Yeah, thank you.
Thank you, Francis. Next, we are going to hear from Al Hassan, who is working right now underground in Sierra Leone. You're welcome.
Thank you, Mary, and thank you, everyone, for giving me this opportunity to join this call today. I am Alansan Sisi. I'm the founder and president of an environmental organization that work with schools in Sierra Leone. We've started discussion before now because we are on the ground and we've started doing some work when we go on radio to do sensitization. But I want to thank Her Excellency Dr. Ikana. As she rightly said, that death does not distinguish race, color, or social strata. And I believe us as a civil society organization, we have our own role to play in this time of need. As she rightly said, in our communities, we see what is going on presently. We had a 3 days lockdown. People were going out to fetch water. We are battling for water. So these are some of the things that she mentioned that we need to also pay attention to. It's not only getting the kids to hit people, but also the social needs, as the other speaker mentioned, the social effects of what we are facing now. Now we see that everybody is important, one way or the other, and I believe if we all come together, we're able to solve these minutes. For us, we've already started discussion over radio and meeting schools, donating some Verenuka bouquet, because I think we've realized what it means during the Ebola crisis in our country. Some of us, we are on the front line trying to sensitize people to say how to keep themselves safe. So we are on the ground, we are ready to work with you guys, and we hope the audience will come through. Thank you all for your time.
Thank you, Al Hassan. Next, we have Dr. Daniel. He's one of the main people who support and help us establish the initiative. And his organization, Team Project 54, is one of the organizations that we are working under. Welcome, Dr. Daniel.
Thank you so much, Mary. Thank you, Your Excellency, Dr. Arikana. Thank you, Ambassador Fode, and thank you to all the global emergency responder. Mary has been a major inspiration. She has conveyed all what you've seen here today. I'm so happy and excited that I'm alive to still see elders like Dr. Arikana and Dr. Fode inspire us. My organization is a non-for-profit based organization here in the United States. We have branches across 159 nations. So we have members and citizens from 159 nations on our platform. Primarily, we advocate for environmental and climate-related issues, especially the health impact, the socioeconomic data or implications of what the climate issues have brought upon us. And clearly, Ma, you are aware also as a medical person that because we have destroyed so much of our natural species, these animals that are vectors or reservoir have moved to where humans live and we cohabit with them. It is the cohabitation of these wild animals or the domestication of this wild animal, or the sales, the illicit sales of this wild animal that has brought us where we are today. So we are totally committed in working with you, not only in raising these packages that can help our people, but also telling our people, we can't continue with this business as usual. You've always been telling Africans this since the time I know you. It's time we stop deceiving ourselves. Let us come and tell ourselves the real truth. We have failed our own people. We cannot be receiving donations from people again. We have to cut down on our own and identify where our problems are. We have to say no to some certain gifts. Not all gifts are good. Not until we tell ourselves the truth and tell ourselves that our style of governance must change. If we are to ensure this COVID is destroyed, address poverty, address inequality, educate people, ensure we create decent jobs, jobs that will not have adverse effect on the environment and on others, push away a religious sentiment, tribalism, nepotism, all these things have to change. COVID will come and go, but the aftermath is that we can never be the same. So we are totally interested in working with you. Thank you all for everyone, and it's good to see familiar faces again. God bless.
Thank you, Dr. Daniel. I would like to thank all the youth from the Global Emergency Disaster Response for their intervention. They all come together and they have sent their voices to support the initiative by Dr. Arikana to work in the Emergency Response Center in Africa. So right now, here we have our voices and the youth support from us, and we are giving it back to you, and let us work on it. So thank you. Abdullah is back to you right now. Okay, then I would like to call Ambassador Arikana again to conclude for us, or to give us a comment about what her thought about what we have been sharing. Welcome back, Ambassador Arikana.
Thank you again, Mary. And again, once again, I want to thank all of you for your interventions. I think that the time is now. All of you in various ways, you have summarized what really needs to happen. I think the establishment of these centers, like our brother representing the Dangote Foundation, these regional distribution centers are a must, because it's not every country that's going to be an epicenter. As you can see what's happening in the United States, it's not every state that's going to end up being an epicenter. The epicenters are also going to shift. So what we need is to have supplies in a specific location in a region for easy mobilization to whatever country ends up being the epicenter. There's no point in having the supplies sitting in one country. I think I've lost you. Okay. There's no point in having supplies sitting in one country when another country needs them more. So the establishment of these distribution centers, emergency response distribution centers, and I really, really love the idea that this initiative is being supported by the youth, because this is your future, and we're counting on you to lead this initiative. And on my end, I can tell you, I support the youth wholeheartedly, and I do feel that if this initiative is led by the youth, it's more likely to succeed, because this is your time, this is your future, and we owe it to you. So I am so grateful for the support. I appreciate all of you for coming together and making this happen. Dr. Forde, I cannot thank you enough. Mary, I can't thank you enough. Dr. Daniel, for all the wonderful work that you are doing to bring the youth of the world together, and also to say we stand up. And as Africans, no more can we just sit back and expect for donors to come and save us. No, we're very capable of saving ourselves. If each and every one of us was to come up with $1 today, there are over 400 million Black people in the diaspora. If just a fraction of us could come up with $1, now make it $5, now make it $10. We can do this. And I really appreciate you youth coming up and starting this initiative and supporting the initiative. I look forward to working with all of you. I will be trying to do my best to update you on a weekly basis in terms of the statistics, the changes in the numbers on our continent. The rate at which these numbers are rising is frightening. So let's make no mistake about it, my young children. It is a carnage. It is a tsunami that's heading towards our continent, and everybody must understand that. So each and every one of you, I urge you to do your best to share this message, to awaken those among us who are not yet awoken to what is going on. And I agree with the young man who spoke earlier to say we're still having conversations from some that are questioning, is this real or is this not real? The reality is it is real. And this is a very vicious virus that we really must do everything we can to mitigate what is the inevitable that is getting ready to happen in our continent. I look forward to working with all of you. And once again, encourage everyone to go to ouraddi.org. If $1 is what you have, then it is $1 that you give. If expertise is what you have, start being prepared to organize yourself. So if need be, if we have to dispatch diaspora doctors, we want to be ready to also dispatch the doctors. For the doctors and nurses and other healthcare workers to go to Africa, we need to be able to be prepared to fund their transport to go there. So at every level, funds are needed if the diaspora are going to play our part in supporting our heads of states and government in doing what we need to do to save lives in our beloved continent. I thank you.
Thank you, Dr. Arikana, and thank you for all the viewers who have been following us since we started our press conference for today. We'd like to thank also Reverend Polite and team of the New York Times for their support, and thank you for SierraCast for all the coverage and all the media support they have been offering for us and sending our message using their platform. Thank you for all the African community in the diaspora out there who are listening to us, who are following us, who are sending us their messages, who have hope of and trust in us that we will be working together with the team of Global Emergency Disaster Response. See you next time. It's just the beginning, and we are doing our work together, and we will be working in building the Africa that we want and fight the COVID-19. Thank you.
Okay, thank you very much, viewers. As you could hear from the Global Emergency Response Disaster team with youth around the globe and with their membership, as said by with Dr. Daniel, and with their total support for Dr. Arikana initiative, I think that's gonna make a big difference in the world. So we thank you very much, and as you could add from Dr. Arikana, please go to the ADDI website and support. Even you can give $1. That makes a difference. Let's support Dr. Arikana initiative, at which will save lives in the continent of Africa. And this is SierraCast TV, and we will be bringing you the initiative and bringing you global emergency disaster response team, and also with the initiative of Dr. Arikana for the establishment of a COVID-19 emergency disaster response center in Africa. We thank you, viewers, and we will be coming to you time and time to give you latest developments with this initiative for Africa people. We thank you very much, and we will get back to you at any time soon with Dr. Eric Khan.
work of the youth that we are doing from the Global Emergency Disaster Response, and our partners from different parts of the world, 71 countries. We have prepared this amazing video, short video, about supporting Ambassador Arikana, the former ambassador to the AU, for establishing the first COVID-19 center response for emergency in Africa. So here it is. Please watch it and share it with others, and come with us. Contact us if we want to do the same work or join our initiative. So enjoy it and share it with your friends and network. Bye.
Hi friends, my name is Alicia and I'm a member of the Global Disaster Responders Network, and I support Ambassador Dr. Arikana 100% in establishing COVID-19 Emergency Center in Africa. Thank you.
Hello everyone, I am Ambassador Abdul Kaloko and I'm part of the Global Emergency Disaster Response Team, and I am supporting Dr. Arikana in establishing Africa's COVID-19 response centers across Africa.
Hello everyone, my name is Mary Apollo. I'm part of the Global Emergency Disaster Response Network. I support Dr. Arikana to establish the COVID-19 Emergency Response Center in Africa.
Hello everyone, my name is Dr. Daniel Chidube Mbuji. I'm a member of the Global Emergency Disaster Response Network, and we totally support Ambassador Arikana as she plans to establish the COVID Response Center in Africa. Thank you.